Came along today hoping to see what ways we can use technology to kind of to deliver effective health promotion messages to kind of some of our most at-risk patient groups, I guess, including like young people who use a lot of technology in their everyday lives, like Facebook, kind of social media, that sort of thing.
I thought today's meetup was excellent. We all came together to look at a particular challenge around sexual health, and what we had is a mixture of people with clinical backgrounds, technical backgrounds, consultancy backgrounds, and together we were able to tackle these problems in our groups, think about them from different angles, and come up with much more imaginative solutions than we otherwise would if we'd all been sat individually.
It's been really useful kind of hearing from Dr. Bailey about what's out there in terms of kind of innovation between academics and tech sector, and then the ideas. I thought, oh God, how are we going to come up with 10 ideas in 10 minutes basically? But we could easily have just carried on coming up with more and more ideas once we got started, because there's such a good mix of people at the table.
I think it's great to hear what other ideas people have, and I think there's something, what I really liked about this is they gave you a really specific example of who you were targeting, because it really makes you think down to like the reality of the situation, who's really being affected and how you can help them.
Today I was just reassured that there is a great power in collective brain, in people, meeting together and working on ideas together, and basically in networking.
I came to the meetup because I was really interested by the title, actually. I thought it was an interesting topic to explore, one that is usually quite taboo within society. We can't talk about men wearing condoms, so this seemed like a very kind of innovative and quite unusual sort of evening.
Just an hour and a half together, I think we made a great deal of progress in coming up with some really interesting, new and novel solutions to what is quite a difficult issue.
It's a great chance to meet other people that are in the field and doing other things as well in technology, and just to share ideas.
I think it was a very interesting meetup. It was great that it was interactive. I think that yielded quite a lot of fascinating ideas, and because the people here, the crowd here is so diverse, that was another sort of important factor.
I feel like I've arrived, I feel like I've been educated in the area, I feel like I've had a chance to participate and contribute something towards the whole discussion.
And it's been a really interesting mix of people here today, so clinicians, healthcare people, people from charities, but also kind of game and technology designers as well. And I guess it's been really good kind of working together and kind of seeing how we can overcome some of the challenges to kind of develop software and applications that are going to be acceptable and accessible to the kind of the groups of people that we want to see in our clinics, accessing kind of healthcare and sexual health messages.